Hey folks, it's Beth Wright. Guess who? And this is going to be a podcast for Unit 4, Chapter 33. And what I decided to do, because there's so many of these medications and things, decided to split this up into two different podcasts. And we're going to first, with this one, address vitamins. Okay, so we need to first talk about, and this will apply to both vitamins and minerals, but we're going to first talk about what does the body need, okay? We have to have lots of water. It's important to drink water. We need around 2,000 to 3,000 milliliters per day for good metabolism to happen and for excretion to happen. And that's, a lot of times folks don't do that. And that is one thing we need to be sure to ask the patients about is how much are you taking in? How much are you drinking? How much water are you drinking? How much other things are you drinking? Because what you're going to find is other than water, a lot of things that we drink can cause you to dehydrate. It's got, for instance, coffee. A lot of people are coffee drinkers, and, coffee has the caffeine in it, and that can, it has its own set of side effects. Mountain Dew is a common thing, or soft drinks. So they have their little side effects that can occur. So it's important, though, that we find out how much the patient is taking in and drinking, okay? Because, that's going to impact our kidney function as well as our cellular metabolism. Now, when you see in your reading, it's going to talk about kilocalories. Now, 1,000 kilocalories equals 1 calorie. So just kind of keep that in mind. And in your book, it talks about 4 kilocalories per day are needed in the carbohydrates for energy for that cellular metabolism. Now, your ATI resources that you will soon have refers to 40 to 65% of the diet needing to be from carbs, from carbohydrates. Fats, also known as lipids. Now, a lot of times we say, oh, we shouldn't eat a lot of fats. But listen, we need fats. We need a certain amount of fats in our body. Now, your book talks about 9 kilocalories needed for energy for the cellular metabolism. Your ATI resource reflects 20 to 30% of the diet needing to be of lipids or fats. And then protein. So 4 kilocalories are needed per day according to your farm textbook. And the structural and functional component of tissue and energy sources there is what's needed there. Your ATI resource refers to 10 to 35% of the diet needing to be from protein. Now, there are times when each of these things may be adjusted: carbohydrates, fats, proteins. For instance, if a diabetic clients, they're going to have an adjusted carbohydrate amount. For fats, okay, someone who is obese or who, may have heart disease, that kind of thing, those amounts for the fats may be adjusted. Proteins, someone with kidney disease, someone who has had surgery, um, you know, that's when you might see proteins adjusted for those different reasons. Okay, and then vitamins are required for a lot of different reactions that happen. It's a catalyst for metabolic function and chemical reactions to occur within our body. So we definitely need the vitamin sources. And then, of course, we have minerals and electrolytes, and those are used at every cellular level. So vitamins and minerals and electrolytes are all very, very, very important within the body. And the old saying, you are what you eat, Um, you'll see that many times with individuals. In addition to these items, we also need amino acids and fatty acids, and we get uh, these ingredients by what we ingest or digest. When someone is sick um, and that they can't ingest or digest or absorb, then that's going to affect the nutritional status of the patient. And the nutritional status plays a major, major role in maintaining health and in many, many disease processes to help manage that disease process. And it directly affects enzyme functions and the immune response and healing. So, nutrition is extremely important. And when you get into your Nursing 108, you're going to have a unit that will be devoted to nutrition. And you'll hear nutrition almost in every unit that you um, go through in the nursing program. So let's talk specifically about vitamins for this part, what's required for normal body metabolism, growth, and development. And it is part of that enzyme system that releases energy from ingested carbohydrates, proteins, and fats. And it is required for the formation of our red blood cells, our nerve cells, our hormones, and genetic materials, and bone and other tissue. Now, minerals are essential for bone, teeth, cell membrane, connective tissue, and other essential enzymes, and it helps us maintain fluid and electrolyte and acid-base balance. Um, Osmotic pressure it has to be maintained within the body in order for us to be able to function. The minerals and electrolytes help with that. They help with the nerves and muscle function and assist in diffusion of our oxygen, our carbon dioxide, and all of the chemical things that reactions that happen in our body. And of course, it influences the growth process as well. So you got to get a little question there. Vitamins are required for formation of RBCs, nerve cells, hormones, genetic materials, and bone or other tissue. And hopefully you said true. So we know that vitamins are definitely necessary and they help us function basically to our best possible state that we can. All right, let's talk about our fat-soluble vitamins first. So those are the vitamins A, D, E, and K, and they are stored in the body when taken in excess, which, we need those stored in the body. But excessive amounts of vitamins can be harmful too. So fat soluble means that they dissolve in fat, and because these are stored in fat, there's a possibility of toxicity. So anytime something is stored in our fat cells, we keep it a while longer because fat cells don't go away, as we might know on a personal level. Absorption of these vitamins depend on our ability to absorb fat. Now, water-soluble vitamins are our vitamin Bs, complex vitamins, and there's several of the vitamin Bs, and vitamin C. And they are not stored in the body. They are rapidly eliminated. So guidelines for vitamins. We know that certain people need vitamins more so than others, like pregnant women, uh, folks who smoke, or folks who ingest a large amount of alcohol, or who have an impaired immune system, or the elderly folks, and mainly because the elderly folks, have all the organs have stopped working like they normally would, and those kinds of things. A lot of times, they're affected because they don't want to eat or drink like they normally could. Sometimes they have denture problems where, they can't eat, where they don't fit, the dentures don't fit, so they don't eat like they should. So that's, one of the reasons why elderly is included in that. We need to understand that taking a large amount of vitamins can actually cause definite problems. So, the saying more is better is not the case here. Um, Patients should only take the required amount, and you have in your textbook on page 610, the box 33.1, it tells you about, the required daily amount that's needed. And it describes the tolerable upper intake level of most vitamins and minerals. Now, natural vitamins advertise as being better than synthetic vitamins, but there is no evidence to support that. The two types are chemically identical, and they work the same way in the body. And the natural vitamins are more expensive. So, just keeping that in mind with individuals, because a lot of times expense is a major factor for patients. Vitamins from supplements exert the same physiological effect as they do when they are obtained from foods. Multivitamins often and contain minerals, and usually in smaller amounts than those recommended. Large doses of minerals are toxic to the system, so we've got to be careful about that. Supplementary vitamin preps differ widely in amounts and the types of vitamins content. So it's going to be important to teach the patient to read the label there. You need to compare ingredients and cost. And store brands are usually effective and less expensive than the name brands. Um, Now, one of our jobs is to promote wellness, and so at some point in your professional career, you'll be talking about vitamins and mineral supplements, and it's important to explain to folks about too much can cause harm. Also, talking about foods and diet that can help with the consumption of vitamins, because that is the best way to get the vitamins, is by having a healthy diet. That's the best way to get the vitamins. But sometimes people can't, um, for whatever reason, disease process or what have you. Uh, so they may have to take the vitamins. They also need to talk to their provider about taking vitamins as well. Okay, so let's talk about first the fat soluble ones. So this is vitamin A, retinol, or beta carotene, and it's going to be important that um, we know what these are for. So vitamin A is needed for vision health. The old saying your mama probably told you, eat your carrots. It's good for tissue strength and growth and embryonic development as well, and the skin and mucous membranes, and for healing anytime there's any kind of injury to tissue and that kind of thing. So you see the list of good sources there. Note that we have colorful items, orange and yellow. We may have liver, and we have dietary products, also some greens in there as well. So it's important that you know those sources so you can teach your patient. Now, excessive amounts of vitamin A are stored in the body and can lead to toxic effects. So high doses of vitamin A can result in headache, diarrhea, nausea, loss of appetite, dry, itchy skin, and elevated blood calcium level. Long-term use of large amounts of vitamin A might cause serious side effects, and even to the point of mental changes, fatigue, irritability, stomach upset, anorexia, vomiting, mild fever, excessive sweating, and, other adverse effects as well. In women who have past menopause phase, taking too much vitamin A can increase the risk of osteoporosis and hip fractures as well. Now, deficiencies in vitamin A will have clinical manifestations or signs and symptoms. When you see clinical manifestations, that means signs and symptoms. So, what we might see in folks who are deficient with vitamin A is, reduced night vision, dry, thick eyes, xerophthalmia is the medical term for that, skin and mucous membrane changes. If a person is having skin changes, that can lead to skin lesions, which can lead to infections. Mucosal problems can cause issues with the respiratory tract and infections. So we have to be thinking about that as well. Um, do not take supplementary vitamin products that contain more than recommended amount because of those possible adverse effects. And pregnant or could become pregnant, we need to know that excessive doses can cause birth defects. So that's going to be very important to teach your patient about. Pharmacokinetics and use, so it's absorbed in the GI tract with dietary fat, and it's stored in the liver, and it attaches to protein, and it is metabolized in the liver and excreted in the feces and urine. So, adverse effects could be hair loss, double vision, headaches, neurological issues, vomiting, bone pain, and liver damage. Liver damage, again, we're going to see, possible jaundice of individuals, an enlarged liver, which they call hepatomegaly. So we have to be aware of that. Contraindicated with allergies and hypervitaminosis A, meaning they got too much vitamin A in them, and malabsorption syndrome. So we want to prevent interactions here. Chronic use of mineral oil or bile acid sequestrants, which is referred to as a cholestyramine, may cause deficiency due to preventing absorption. So those bile acid sequestrants are a group of medications used to bind certain components of the bile in the GI tract, and it's used to help lower cholesterol, or it can be used for someone with chronic diarrhea and bile acid malabsorption due to the gallbladder being removed. The medication disrupts the circulation of bile acids by combining with bile and preventing their reabsorption from the gut. Now, bile salts, which help with emulsifying fats or breaking down fats, can increase vitamin A effects by increasing the absorption. Vitamin A, large doses can increase the effects of warfarin, which is an anticoagulant. And warfarin is used for thrombus. Anticoagulant means to decrease or stop the clotting of platelets. Okay, so a lot of times that's given because of a thrombus and ischemic tissue damage, and the warfarin helps with preventing secondary thromboembolic development to occur there. So a lot of times we refer to that as a blood thinner, and it can cause, if it's increased, it can cause the blood to be too thin, and we can see hemorrhage happening or bleeding happening. So we monitor patients who are on warfarin for bleeding, because that can certainly be an adverse effect of that medicine. And we watch about the gums and the urine and the stool to see if there are any kind of visible blood, or the stool may have dark brown, black, tarry look to it. Petechiae are small little bruising things going on underneath the skin, and so, or easily bruising can be a sign of bleeding as well. So we got to teach the patients to watch about that. And there's also lab work that they get when they're on warfarin. The prothrombin time and an INR are the lab works for that. So we got to be watching about that anytime they take vitamin A with that. Antibiotics that cause diarrhea may lead to malabsorption, so may cause a problem with absorbing vitamin A. So it's best to administer it on a stomach, empty stomach, and definitely not with mineral oil. And there's teaching in your textbook, box 33.2. Definitely need to take a look at that. Always, we got to assess for therapeutic effect and adverse effects. Never forget that. That's part of our role as a nurse. Okay, vitamin D. I added some things about vitamin D because the book, in your textbook, in one of the tables, it refers you to another chapter. But I'm going to I've put in what I think you need to know at this point about vitamin D. But when you think about vitamin D, you got to think about calcium, because that's what promotes the absorption of calcium in that GI tract. Good sources, you can see the list there. And don't forget, sunshine is a way to get that vitamin D as well. And vitamin D is useful for the treatment of rickets, which is a bone disease. And, we don't see that a lot anymore, but it used to be a pretty big thing. Other vitamin D deficiencies, such as osteoporosis, where the bones have been weakened, and hypoparathyroidism. So let me explain a minute about that. So our parathyroid gland secretes the parathyroid hormone, and it stays, in a good balance. And when the parathyroid hormone is excreted is when our calcium level in the blood drops. Okay, when it is decreased from what it should be. So when we think about calcium, calcium is in our blood, but it's also mostly in our bones and teeth, that area. So when our blood level drops, the parathyroid hormone secretes, and it pushes the calcium out of the bone so that our serum level gets back to normal. And then the parathyroid hormone stops secreting when that level is good. So when there is a problem with the parathyroid gland, be it cancer or some other, it can also, can be somebody who's had surgery on their thyroid gland, because that's where your parathyroid gland is around that thyroid gland. So if somebody has to have thyroid surgery, then something might happen with the parathyroid gland. So when someone has hypoparathyroidism, they may have to take vitamin D to help with the absorption of the calcium in the GI tract. Okay, and now we're talking about vitamin E. So vitamin E is an important source of vitamins that we need, and it is needed for preventing destruction of fats, especially the lipid portion of the cell membrane, and it helps preserve muscles and red blood cells, and it helps maintain the myelin sheet that insulates the nerve cells. So very important, and you pronounce that tocopherol um, is the generic name for that medication. Now you see those dietary sources, and a deficiency in vitamin E can cause anemia, hemolytic anemia, and affect the nerve fibers that help us with walking and vision. And we shouldn't take supplementary vitamin products that contain more than a recommended amount. And you're going to see that with every vitamin. So it's absorbed in the GI tract with a fat absorption and stored in the fat cells, metabolized in the liver, and excreted in the bile. We take it PO. Adverse effects, excessive doses can cause fatigue, headache, blurred vision, nausea, diarrhea, issues with vitamin K by decreasing uh, clotting platelets, so that could cause a risk for bleeding there. Contraindicated, again, you're going to see that hypervitaminosis E or hypervitaminosis with any of the vitamins. Um, History of bleeding disorders or thrombocytopenia, which is a low platelet count. Thrombo or thrombocytes, thrombocytes are platelets. Cyto is cell, penia means low. Okay, so thrombocytopenia is a low platelet count. I provided you with the normal platelet count there that you need to know. So the normal platelet count is 150,000 to 400,000. When we don't have enough platelets, then that means our blood is not going to be clotting like it normally should. And that means we are higher risk for bleeding. So if you have a patient that has a platelet count of 100,000, let's say, or 90,000, those folks are at risk for bleeding. Okay, and again, we're going to check those patients numerous ways. We're going to look at their gums, we're going to look at their skin. Do we see any bruising going on? Do we see petechiae going on, which is the small little red dots or purple dots that you see on patients? That's small bleeding that's going on. We're going to look at their urine to see what color is. If you see a dark urine color, or sometimes you're going to see a bright red. You obviously know there's bleeding going on. The dark color can be old blood, if you will, breakdown on the red blood cells coming through the kidneys too. So that needs to be investigated. It's never normal to have a dark urine. We're going to look at the stool, the feces, to see if there's any visible blood. There's actually a test that you can do, we call hemoccult, occult stool test that looks for hidden blood, blood that's not visible to the eye. Also, if the stools are dark, tarry looking, that's also a concern as well. Now, if we have a person who has 500,000 platelets, what would be going on then? So we're clotting too much. If we're clotting too much in the vessels, then we could be obstructing the blood flow in the vessels, and that can lead to thrombus or blood clots forming, and that can also lead to things such as a heart attack because the blood can't get to the heart. Then it's going to cause that oxygen not getting to the heart, as well as nutrients not getting to the heart. So too many platelets can be a major problem as well. So you need to know your normal platelet count for sure. Okay, preventing interactions. So mineral oil and bile acid sequestrants can decrease this. These may increase the effects of warfarin. And so you see that's the same as the other one there. Um, And we need to take on an empty stomach if possible. Always assess for therapeutic effects and adverse effects. And don't forget about the teaching. Always important to do the teaching with the patient. Okay, vitamin K, uh, pitonadione, um, is your generic name there. Now, vitamin K is essential for normal blood clotting. It is the prothrombin production is what it actually works at, and it activates precursor proteins that help and helps in the bone metabolism as well. And you know, when you think about vitamin K, you probably, if you look at that, you're seeing green leafy vegetables is one of the things that comes to mind when you think about vitamin K. Um, Always need to avoid excess doses and keep the intake of vitamin K containing foods constant in the body. We shouldn't overdo it. Um, Avoid sudden increases or decreases in the amount of those food. And you're going to hear about vitamin K and diet issues with warfarin when you study about warfarin. And warfarin, you already know, is a blood thinner that we use for patients who have blood clots. And, you know, the thing is, vitamin K actually is the antidote for too much warfarin. So we've got to teach people who are on warfarin to only keep their, you know, keep the vitamin K diet in their food at a constant level. They do not want to overdo that at all, for sure. And let's see. I think that's all on that one that I wanted to share. Um, okay, vitamin K, it's concentrated in the liver. It crosses placental barriers and breast milk and metabolized in the liver and excreted in the bile and the urine. It is used, it can correct hypothromboemia. It reverses toxic effects of warfarin, and it prevents hemorrhagic diseases in the newborns. And so it's given to all newborns like 1 hour right after birth, and it's given IM. Adverse effects can be mild flushing of the face, altered taste, redness at the injection site, and pain. It does have a black box warning for IV. An anaphylactic shock is what's, you know, the concern here. Always pay attention to your black box warnings. And anaphylactic shock, what are going to be your signs and symptoms of that? What are you going to see with your patient? We're going to see, remember about that ABCs. We got to take care of our ABCs on that. So we're going to see maybe bronchospasms, bronchoconstriction, excuse me, diaphoresis, dyspnea, difficulty breathing, low blood pressure, hypotension. We can see a fever even with that as well. It can also cause cardiopulmonary arrest and death. IM injections have also been associated with that as well. So you know what we're going to have nearby when we're given this IV. A crash cart with equipment that's needed for the ABCs, airway, breathing part, and medications to help with the cardiac and end of it as well. Administration, it can be given PO, sub-Q, or IM. So we want to prevent interactions. Again, you're going to see mineral oil and bile acid sequestrants there. Remember about increased vitamin K decreases the warfarin effect, the anticoagulant effect, so that can be problematic. The administration, oral or sub-Q, is preferred. No issue taken with food. Um, and IMIV, remember about the black box warning. And the medication also needs to be protected from light. Some medicines are light sensitive, so we have to keep them in a dark bottle or dark bag, whatever, however you're giving it. We got to assess for therapeutic effects. If we're giving it IV or IM, we got to have that emergency equipment nearby. And don't forget about your teaching. Always, always, always important. Now, let's talk about our water-soluble vitamins, okay? So we got vitamin Bs, we got vitamin B1, B2, B3, and 6, okay? We're going to also talk about B12 in a minute, but let's keep these together now. So vitamin B1 is thiamine, and thiamine is needed for coenzymes of carbohydrate metabolism. Also, it's needed for digestion, peristalsis, energy to smooth muscles, glands, and the CNS, the central nervous system, and blood vessels. Vitamin B2, or riboflavin, is needed for metabolism, growth, and healing, and may function in the production of corticosteroids that are needed by the body and red blood cells as gluconeogenesis, producing glucose. Okay, so it's thought that that one is involved there. Our niacin, B3, is helpful in the metabolism of fats, glucose, and alcohol, and it's involved in tissue respirations as well, and it's a coenzyme for a lot of metabolic processes. And then our B6, our pyridoxine, is needed for cellular function and synthesis of the hemoglobin, neurotransmitters, and niacin. And it helps release of glycogen from the liver and the muscles and helps with cellular immunity. And so you see what sources there for thiamine and for the riboflavin down below that. And these are good sources of the niacin and the pyridoxine. Okay, deficiencies with B1, the thiamine, you'll see mild fatigue, anorexia, retarded growth, mental depression. With severe B1 thiamine, we see a situation called condition called beriberi, and that is where again the body doesn't have enough B1 or thiamine. There's actually two types of beriberi. One is a dry beriberi, and one is a wet beriberi. And Wernicke's Korsakoff syndrome is involved also with the dry beriberi, and it affects the nervous system. A lot of times where we see this is folks who drink alcohol heavily, and that can lead to poor nutrition, and it makes it harder. The alcohol makes it harder for the body to absorb and store thiamine. So it's a rare condition other than seeing it in those. And so you might see individuals on a supplement of thiamine. So, it can be very serious, the very can. The deficiency of the B2 riboflavin is a chelosis, which involves like a breaking of the skin around the lips. You may have seen cracked lips there, especially at the ends of the lips. They also can have a smooth, swollen red tongue, stomatitis, glossitis. Stomatitis is where the oral mucosa is inflamed. Glossitis is the tongue where it's inflamed. Also, eye disorders, photophobia, meaning that the eyes are extremely sensitive to light. Vascularization of the cornea, meaning that there's extra vessels that are forming in there, which isn't good. And dermatitis of the skin. Now, your B3, that can definitely cause an issue with your pellagra. Pellagra is a disease that occurs when people don't have enough vitamin B3 or niacin, um, and they can have symptoms such as delusions, diarrhea, inflamed mucous membranes, mental confusion, and scaly skin sores with that. They can also have GI issues, stomatitis, glossitis, enteritis, meaning the intestines are inflamed, and diarrhea. And then our vitamin B6, and that one is our pyridoxine. Deficiencies with that can be anemia, central nervous system issues such as seizures, peripheral neuritis, where your nerves are inflamed in the lower extremities or in the upper extremities too, mental depression, skin and mucous membrane lesions as well. So with these, they are absorbed in the GI tract. The thiamine does enter the breast milk. Niacin can cross the placenta and breast milk. Pyridoxine crosses the placenta, and these are stored in the liver. The use is for illnesses that are caused by vitamin deficiencies. Renal impaired, use niacin and pyridoxine with caution. The liver disease should not use niacin. And adverse effects, the thiamine, can have allergic reaction with that. Niacin can have liver impaired issues, active peptic ulcer disease, arterial bleeding, and lactation should be some things that we need to be watching for. You've got to use and caution with anybody who has liver issues or hepatobiliary issues, peptic ulcer, high alcohol use, renal or unstable angina, gout, which is a type of arthritis, diabetes, and glaucoma, which is an eye disease. May experience vasodilatation with niacin. So we, know that when the vessels are dilated, we can have a drop in our blood pressure and it can cause dizziness. So we need to teach the patient about that. And about fall precaution there, the things that, when they change positions, they need to do so slowly. If they're dizzy, they need to sit down, and that kind of thing. Pyridoxine, IV, cardiac disease, and caution with renal impaired. Now, the B1 and B6 can be given IV or IM or PO, and the B2 and 3 can be given PO. So we want to prevent interactions there with the niacin. It can increase the risk of rhabdomyolysis from statins. What statins are medications used to treat cholesterol issues. Now, rhabdomyolysis, if you see in the middle of that word myo, think muscle when you see myo, okay? So rhabdomyolysis is a weird syndrome that can occur from many different things, but it can occur from different medicines as well, from taking different medicines. and it's where the muscles literally uh, get so damaged that they can die and won't work. And I've seen this in a few patients before, so we've got to be alert. If a patient is complaining of pain in particular muscles, then we need to look at their med list and see what's going on there. It can increase the effectiveness of antihypertensives and vasoactive drugs, so we got to be careful with that. We don't want someone to be hypotensive, right? It can increase the risk of bleeding with anticoagulants. And of course, once again, the bile acid sequestrants can deal with the absorption. So you've seen that bile acid sequestrants pretty much in every single one of them as decreasing absorption. Pyridoxine can increase peripheral conversion of levodopa into dopamine, decreasing the amount available. Now, levodopa is what's used for Parkinson's patients. And so any Parkinson patient that we got to, think about them on this type of medication. Um, Isoniazid is medications that's used for tuberculosis, so it would decrease the effects of the pyridoxine if they're taking that. Administration, we got to swallow. Extended release products whole, don't crush, break, or chew. So we need to teach the patient about that. And oral niacin preparations, we need to, recommend they take that, except for the time release forms with or after meals or at bedtime to decrease the stomach irritation. Also, with the niacin, they need to sit and lie down for 30 minutes, sit or lie down for 30 minutes after they take it due to that vasodilation effect, and that will help prevent any kind of falls. Let's see. So we've already talked about that. Niacin causes blood vessels to dilate, and that also not only causes hypotension, but it can cause facial flushing as well, and again dizziness and falls. The facial flushing can be decreased by taking aspirin orally 30 to 60 minutes before a dose of niacin, as long as it's not contraindicated. So, of course, that would need to be discussed with the healthcare provider and prescribed by the healthcare provider. Itching, tingling, and a headache may occur with this. These effects usually subside after they, continue to use the niacin. Again, we need to assess for therapeutic effects and always provide that teaching. So be sure to look at your teaching. And then vitamin B12 is our medication there, and cobalamin is your generic name of that medicine. Now, vitamin B12 is needed for red blood cell production and normal metabolism of all cells, nerves. It's needed for cell growth and metabolism of carbohydrates, proteins, and fats. And vitamin B12 requires an intrinsic factor that's in the stomach in order to be absorbed. So people with stomach issues may not be able to absorb vitamin B12. So we may have those folks may automatically be vitamin B12 deficient. So we got to think about that as with anybody with stomach issues, okay? So of course you see your good sources there of vitamin B12. We need to know about those dietary sources of vitamin B12 and folic acid as well. So we're including this one, folic acid, with this. And you can see good sources of folic acid. Now, folic acid is needed. One of the things that they've found several years back is that a deficiency in folic acid for pregnant women can cause a neural tube um, meningeal seals in babies, and so neurotubes deficits or disorders in children. So it's important that mamas, pregnant mamas, eat good foods, high sources of folic acid. So our deficiencies here are with B12, we can have pernicious anemia, and that is where we have a decrease in our red blood cells due to production issues of the red blood cells, or it could be due to a lack of that intrinsic factor in the stomach. Um, Megaloblastic anemia is caused by incomplete formation of the red blood cells, resulting in a large number of immature and incompletely developed cells. These red blood cells do not function like a healthy red blood cell, and they crowd out the healthy cells, causing anemia. And since these cells are underdeveloped, they are also have a short life expectancy as well. Um, Also, we can see dyspnea, fatigue. With severe deficiencies, we can see leukopenia. Leukocytes are your white blood cells. Penia means decrease, so we can have a low white blood cell count, which can lead the patient to infection. Thrombocytopenia, once again, problems with our platelets. Cardiac dysrhythmias, heart failure, neurological signs, paresthesia in the hand and feet, unsteady gait, decreased deep tendon reflexes, memory, confusion, delusion, hallucination, psychosis, nerve damage can be permanent. Um, for folic acid, we can see the megaloblastic anemia, impaired growth in children, glossitis, and GI problems. Now, I've provided you a pictogram in there, and you can see the B12 is there on your right side, and it talks about that. And that's the only one that was on there, but I thought that would be important for you to see. Okay, so nursing implications, we need to prevent the drug-drug interactions, and uh, omeprazole is the medications listed with B12. A lot of people take that. That's for GERD, stomach issues. Folic acid, decreased effects by aspirin. A lot of medications can definitely cause problems with that. Your sulfonylureas are medications that's used by diabetics. They're oral anti-diabetic medicines or hypoglycemic actions. Uh, Hyperglycemic medications, oral diabetic medications. Your trimethoprim are your anti-infectives, so you see several things that can be affected by that. Once again, you see the bile acid sequestrants. Um, Oral contraceptives can decrease absorption here. Methotrexate is a medicine that's used for autoimmune disorders such as arthritis, rheumatoid arthritis, or other autoimmune disorders. It's also used for cancer. And phenytoin is an anti-seizure medicine. Um, so these act as antagonists and go against the um, the principle of B12. Alcohol can affect storage of folic acid in the liver. Um, Folic acid increases phenytoin metabolism, which decreases the serum level available. So we got to teach seizure patients about that. Adverse effects: B12 can cause hypokalemia, which is a low potassium level. There is a slight risk of anaphylactic shock, and folic acid, we can have bronchospasms. So those all sound pretty serious to me. We need to teach people always take as prescribed. And if they have pernicious anemia, they're going to have injections of B12. And any chronic B12 deficiency is going to require lifelong treatment. Pregnant and breastfeeding may need a higher amount. Um, and we definitely, for people who have the chronic vitamin B12 deficiency, they need a follow-up visit with their doctors throughout their life, and they may need necessary lab work to be done to check, like the red blood cells, for instance, and that's done with a complete blood count, CBC, and we look at those red blood cells in for that particular type of anemia. And always, always, we're going to teach. Vitamin C, ascorbic acid. Know about the sources there, but vitamin C aids in the tissue building and metabolic reactions, wound and fracture healing, collagen formation, adrenaline production, iron absorption and metabolism, um, and conversion of folic acid, cellular adhesions, resistance to infection, preserves blood vessel integrity, and synthesis of fats and proteins. Stress and illness also increases the need for vitamin C. Um, Again, vitamin C improves that absorption of iron, and also vitamin C will acidify the urine, so it might alter excretion of some drugs. Sometimes you'll see drugs that say the urine needs to be alkaline. So if that's the case, we would tell patients don't take vitamin C. Now, the deficiency with vitamin C is a condition known as scurvy, and again, we don't see this a whole lot um, in our day and time because a lot of there's a lot of good sources out there of vitamin C. Um, but anyway, that can cause general weakness, anemia, gum disease, and skin hemorrhages. Older adults who aren't getting proper nutrition may be affected by scurvy. The pharmacokinetics absorbed in the GI tract, it does cross the placenta and enter breast milk and metabolized in the liver and excreted by the kidneys. The use is to prevent scurvy now and to acidify urine. Now, there are times when we want the urine to be acid, and that is if we've got a lot of urinary tract infections. The acidic urine can help keep those microorganisms at bay. It can be given PO, IM, or IV. Renal impaired, avoid large doses because they can produce renal stones. And the use is cautioned in people with sickle cell anemia, which is where there's a problem with the types of the blood cells are sickled, and the glucose 6 phosphate deficiency. The glucose 6 phosphate deficiency is a genetic disorder that most often affects males. It generally affects the red blood cells, which, as you know, are important to carrying oxygen to the lungs and to the tissue throughout the body. And it's where a person is deficient in the enzyme glucose 6 phosphate dehydroxygenase. And it causes the red blood cells to break down prematurely, and they can get what they call hemolytic anemia there because it causes a hemolysis of the red blood cells. So that's, not a very common thing that you'll see, but it may be something you might see in your lifetime. Okay, preventing interactions. Acidic urine decreases elimination of aspirin, so need to think about that. We could cause a toxicity issue there with aspirin. It's administered PO with food. Effervescent tablets need to be dissolved. They don't need to take them whole. They got to be dissolved in water first, and then always, always assess for therapeutic effects and adverse effects and do the teaching. So, question, vitamin C improves the absorption of iron? Yay, yay, yay. Yes, it does. Okay, so we're kind of getting to the end here, folks. I know this is long, but we've got to think about the whole nursing process when we're looking and working with people with nutritional deficiencies, okay? We've got to assess these people for current or potential problems with nutritional deficiencies, and you're going to see this a lot. So when we assess, we're going to ask them about what's their usual eating pattern. What did they eat in the last 24 hours? And don't forget to ask how much are they drinking. Does the patient appear underweight? If so, what are contributing factors? I mean, are they on certain foods that's causing them to not be able to eat, or that's causing anorexia? What's their appetite? And, are they have the ability to obtain, cook, or chew food? Again, thinking about those dentures with chewing food. We need to calculate or estimate the body mass index. So a body mass index under 18.5 kilograms is considered undernourished. And so you need to know those values there. Does the patient have symptoms or any disease process or any treatments, medication, or diagnostic tests that's likely to interfere with nutrition? So do we have issues with all of that? With vitamins, assessment factors include the deficiency states, um, definitely what's going on with them, and having the patient explain to us where their what's their nutritional intake, and any other signs and symptoms. Deficiencies of your water-soluble vitamins are more common than those of the fat solubles because, we hang on to those fat solubles. Vitamin deficiencies are usually multiple, and signs and symptoms often overlap, especially with your B complex vitamins. Um, with the vitamins assessment factors, we need the know the vitamin requirements are increased during infancy, pregnancy, lactation, and fever, hyperthyroidism, and many, many illnesses. So vitamin intake that is normally adequate may be inadequate at certain times. Uh, Vitamin deficiencies are likely to occur in people who are economically challenged, are elderly, are chronically and severely ill, and alcoholics. Uh, Vitamin excess states are rarely caused by excessive dietary intake, but usually caused by people taking the drugs. Uh, People thinking more is better. Assessment's going to include applicable lab work. So again, checking that CBC for decreased red blood cells, hemoglobin, and hematocrit. Reduced values may indicate an iron deficient anemia, and further assessment definitely is needed. We're also going to check those electrolytes for abnormal values. All major minerals are measured in the lab. And we pay particular attention to sodium, potassium, and chloride, carbon dioxide content, and bicarb amount is also assessed as well. We want to always, as nursing interventions, promote a well-balanced diet. 5 daily servings of fruit and vegetables provide adequate vitamins unless the patient has an increased requirement needed, such as for pregnancy. Multivitamins may benefit most people, but it's not the substitute of an adequate diet. Remember, that's the best way to get those vitamins and minerals in our diet, in our body, is through a diet. A diet that is adequate in protein and calories. usually provide those minerals and electrolytes. And again, we may need a little bit more in people who are pregnant or in children. We want to also think about providing relief of symptoms that may interfere with nutrition. So, when someone's in pain, they usually don't want to eat. Nausea, you can't eat. Vomiting, can't eat. Diarrhea, a lot of times people do not want to eat. So, if we can take care of those symptoms, then maybe they can get back on track and eating what's, you know, with eating a well-balanced diet. Um, Palatable supplements at appropriate times for patient who need increased protein, calorie intake, and encourage patients to take them. Promote exercise and activity for undernourished patients. It actually may increase appetite, improve digestion, and aid in bowel elimination. Minimize the use of sedative type drugs because obviously, if we're sedated, we can't eat or drink. And constipation and a feeling of fullness may happen as well. We need to weigh patients at regular intervals and calculate or estimate the BMI when it's indicated. We also need to monitor the weight and fluid intake and urine output, vital signs, glucose, serum electrolytes, and complete blood count for patients who are receiving any kind of perennial nutrition, and obtain values daily, weekly, or per the institutional policy, and adjust monitoring based on the patient's status or at when they're at home.